I've been asked 4 times in the last 24 hours, is there anything that you can do for a torn rotator cuff? And the answer is maybe, but let me explain what I mean by that. The rotator cuff is 4 muscles, the supraspinatus, the infraspinatus, the subscapularis, and the teres minor. And what they do is they essentially make your arm go through different motions. And it comes into one common tendon called basically the rotator cuff. And so if the tendon is partially severed, I think that there's amazing things that we can do. If it's completely severed, you need to have surgery. And so there's a way, not only with the MRI, but there's some clinical evaluations that we can do that we're going to do on our underwear model Jordan. Now, we told him he had to keep his clothes on, but we're just going to go through everything here. But let me show you real quick. Over here on my anatomy app, this amazing thing, like the shoulder is this joint that's held on by muscles and tendons. So this is one of the motions that it does. Another motion that it does is bringing you across this way, and then looking at behind, what's pulling it back, this part of the pec muscle that's pulling in to it. So it's not just those 4 muscles. We've got the pec muscle, we've got the deltoids, anterior, middle, and posterior deltoids. So let me show you how to evaluate this. The first thing that I want to know is, like, where's the pain? Like, is it in front and the attachment here? Is it on the side, or is it in the back? And people will tell me it's kind of 30%, 30%, 30%. There's no like guarantee that it's going to be different places. The first thing that I have Jordan do is to just put your arm out like this and put his thumb up and put his thumb down, and like, let's just see, does that hurt? Does that cause any problems? Then we want Jordan to bend his arm like this, come up, all the way up, perfect, like that. Does that bother you? Okay, now keep this here, put all the way down like this. So we're just going through simple motions, internal, external rotation, abduction, and now we're going to start doing a little bit. Let's just see how well the muscle works. So Jordan, hold strong here. Don't let me push down. Don't let me pull up. Don't let me pull up on your hand. Don't let me push down. So Jordan, come make a fist like this right against your side. So I'm just going through all the muscles that are affected by the shoulder. Okay, relax your arm. Hold up. Don't let me pull down. Let me pull down. Don't let me push in. Okay, put your arm down like this. Don't let me push across this way. Don't let me push across this way. No, Jordan's really strong because there's nothing wrong with his shoulder. And then, as weird as it sounds, this really helps me to understand. I'm going to put your arm up like this. Okay, don't let me pull up towards your head. This really bothers people. Don't let me push down. This really bothers people if they have an irritated or strained cuff. Now, if it's partially torn, there's a lot that we can do for it. If it's completely torn, I would recommend, you need to go see a surgeon. The other motion that I was taught by a shoulder specialist is this. So Jordan, put your hand on top of your head like this. Turn this way. Okay. Now this engages like a ton of the rotator cuff muscles. Okay, Jordan, don't let me push up. Push up, push up, push up. Or don't let me push down, you push up. So he's really strong. People with torn rotator cuffs, like that really hurts them. And then the last motion, Jordan has lots of practice with this. Jordan, show us what it's like to get arrested. Like, put your arms behind your back. Okay. People with rotator cuffs, they can't do this. This is a really tough motion for them. Okay, so just relax. So let's talk about, that's just an evaluation that we go through. MRIs are great. I think the clinical exam is super duper critical. And then let's talk about what we can do. Now, one of the best things we can do, we can give the body a whole bunch of building blocks. The mineral that really helps connective tissue to heal that kind of no one talks about is manganese. Manganese is so important for ligaments. Of course, magnesium is the miracle mineral. Those are really important. Collagen and precursors for collagen. There's some other minerals that really accelerate healing. And then there's some signaling molecules that are just fantastic for shoulder health. And so these groups of proteins knock on the door, open the door so you can get stuff into the cells. We call those peptides. So there's some specific peptides that can really help. And if we get the nutrition into the joint, like I've had people heal incredibly fast. By the way, it works even better when we do this injection program and we start doing the right exercises. There's some really gifted physical therapists that make this healing. Like when we combine those together, it's amazing. So we do something called regenerative injection therapy, where we take a specific vitamin and mineral solution and we find the muscle that hurts. Maybe it's the infraspinatus, maybe it's the supraspinatus, maybe it's the here on the attachment, or it's over here where the deltoid attaches on the deltoid tuberosity. Like all of those can be pain points. And we can take that vitamin solution and literally put all the building blocks there so that there's an incredible fast healing mechanism. Now, when we go even faster is when we also support nutritionally the body by skipping the stomach and doing some high dose vitamin mineral infusions. So you put the healing factors there, then what you do is you infuse the body, then you incorporate the right movement patterns and the right rehab, and you can get really, really fast healing. I've done this on people from all over the country that fly into my little railroad town, Pocatello. We put them back together. We're talking professional rodeo players, professional athletes, these weekend warriors that just want to not live here but live up here, and then a whole bunch of different college and high school athletes. So this is not putting pain relievers into the area, because that's one of the things that you can do. You can numb up the area so it doesn't hurt, but in my opinion, it doesn't help you to heal. So that's really quick how we do a shoulder evaluation. We want to know the mechanism injury, where it hurts, which muscle is affected, and then when we do a specific injection technique into those muscles, into the pain points or those attachment points, we can get really rapid healing. So if you like the video, what I'd love you to do is share it. I'm on a mission to help as many people as possible. Smash the like button. If you need help, go over to bestmedicaloptions.com. We have a free survey and evaluation that you can fill out that my team will help you with. Here's to your energy, balance, and longevity, and we'll see you on the next video.